Hi, my name is Cindy Myers.
And I'm Susie Russell, and we're from Charlottesville, Virginia. We are co-owners of a practice called Pain-Free Performance, in which we use the Egoscue techniques to deliver a treatment approach that deals with not only posture realignment, but also many issues of chronic pain and limitations with movement.
We were first exposed to the Egoscue Method after 20 plus years of working in the field of physical therapy, where we were asked to treat people's symptoms. People would come in with neck pain or back pain or shoulder pain or whatever kind of pain, and our goal was to get them out of pain by focusing on that body part. After working with a client, she had told me about a technique called the Egoscue Method, in which her dad had come to San Diego and got treated by the clinic that Pete Egoscue has out in San Diego. And I had never heard of it, so I read his book, Pain-Free. And at that moment, it was like a light bulb moment for me, because the treatment approach was simple, yet so it made so much sense to me. You looked at the body as a whole, you didn't just focus on parts. And I tried to use the method while still working in physical therapy. I had a client who was sent to me with a rotator cuff injury, and in it, I started doing some of the functional tests that we had learned, and I realized that she didn't have a problem with her shoulder at all, that the problem in fact was coming from her hip. And Susie and I were working together as therapists, and I said, Susie, just look at her hip. And she agreed that she had a dysfunction in her hip, and I started giving her some of the E-sizes that I had learned, and I was at that point very basic, just kind of playing around with it, and she got better. She didn't need her rotator cuff surgery. She had full extension and flexion, and she was a happy camper. And so it was at that point I started to really further investigate the method. I also had torn my right medial meniscus, which is in my knee, and knowing that most orthopedists will say surgery because that's what you do when you tear your meniscus, I decided to start trying some of the exercises in Pete Egoscue's book, Pain-Free. And it didn't happen overnight. It wasn't a quick fix, but what was so interesting to me is other things started changing in my body. I felt like I was standing straighter. I used to sit and watch TV, and I would want to crank my neck, and all of those things started to go away. My knee pain would go up and down for a while because I had a torn meniscus, and it just didn't magically stop. But because I could tell other things in my body were changing, I decided to stick with the program. And I have full flexion, I can run, I can do just about anything, and I was so taken by the method that Susie and I decided to step away from the field of physical therapy altogether and use this method solely. We tried to combine it with physical therapy, and I'll let Susie tell you her experiences with that.
Right. You know, I spent 20 years really developing a strong background in physical therapy and helped many, many people through injuries. You had a huge background in manual therapy techniques, believed wholeheartedly in the approaches that we were using, and you know, and when I was trained in my physical therapy background, I was trained to look at the entire system, to look at all of the body functions and how they are all connected. But what I found, at least in Virginia, in the field of physical therapy, is that with the requirements of the clinic and the way that we were practicing, we had to focus on the symptom. We had to get people out of pain, get them moving, focus on where it was they were hurting, and we really just didn't have time to deal with the rest of how the body might interact with that particular injury. And so did I help a lot of people? I'm confident that I did, and we still continue to resource people out to physical therapy because it's a great aspect of their healing. But what I knew was that the whole body needed to work together. You can't, you know, go into the auto shop with a vehicle that needs a new tire and just replace the tire and drive away. You won't do that. You would replace the tire, and then you would get the alignment, because it's that alignment that's going to help you long term to not wear the tire out again. And that's how we look at the body, is if you have a symptom and you rehab that particular area, there's something that was driving into that throughout the body that needs to be addressed. And so what I fell in love with the Egoscue Method was being able to really help a person integrate their entire body and be able to find freedom in movement, freedom in being able to empower their bodies to not just deal with a particular symptom, but deal with recovery of movement through their entire system, as Cindy discovered with her knee, that not only did she gain the benefits of her knee potentially, finally get into a place of full correction.
Right.
But she also gained the benefits throughout the rest of her system. And I think that was the one thing that I found so instrumental in trying to tell people how to think about their posture. I didn't have to tell them to pull their head back, pull their shoulders back, tuck their stomach in, now walk straight, and try to maintain that, because we all know we can't do that. The freedom that you get when you learn how to do these gentle positions, the gentle movement patterns that the Egoscue program teaches, is that you begin to retrain and re-pattern your body to a new place, a new movement, and I think a new freedom of potential that you probably thought you never could retain or regain.
And one question I've had clients ask me over the years, well, they're just exercises. What's so different about these exercises than the ones that you did in physical therapy or the ones you do at the gym? And great question. I didn't understand that at first either, because I used to give people exercises all the time. We look for the dysfunctions that are going on in the body and correct them and fine-tune them based on that client's body. And it is the order and the sequencing that is the secret to this method. You can't just go do a bunch of back strengthening exercises because your back hurts. It may make it feel better temporarily, but if your pelvis is in the wrong position and you're doing these exercises, you actually can be making the dysfunction worse. So that's the piece I think that is a key component.
And I think the main reason why we chose to pull away from the field of physical therapy is I felt that I couldn't accomplish all of it in the 20 minutes that I had with a client. We spend 2 hours in the first visit. It's often, an hour and a half with follow-up sessions. But that time spent is to educate, to be able to teach somebody about their body, and then to empower them to have tools to go home with, to be able to know how to make changes long-term in their bodies. And I have some people that have come from a long distance, that have traveled, and I've seen them once every 6 months. And the exciting part is watching them come back through the door having known that they did their homework each and every day that began to change their body. 6 months later, I took a photo of them, and to see the changes in an 80-year-old person that you would have thought had a fixed posture, that had fixed mechanics that couldn't change. Neck range of motion improved, shoulder range of motion, and just absolute difference in their ability to function. That to me is very, very exciting.
So try the Egoscue method.